In this tutorial, we're going to be talking about how to fix lower back pain if you're a cyclist or for cyclists. Now, there are essentially three mechanisms that could be triggering pain, making it worse. So there are three mechanisms that we need to start thinking about correcting or at least improving off the bike. Now, the three mechanisms is flexion, fatigue, and biomechanics. And what we're going to do is we're going to look at those each individually after this introduction. If you want to apply these principles that I'm talking about, you can click the link below, go through to the How to Overcome Lower Back Pain online course, or I have online coaching there as well with it. So just click one of those links below, go through, enroll, and get yourself started to overcoming lower back pain. Otherwise, let's go straight into the next part. Part number one is all about flexion. So first of all, we've got to find the trigger. So is it flexion that's causing the problem? Because when we're cycling, we've got a flexed spine. We are potentially fatiguing and we may have biomechanics. So it could be all three. So we can't really find that out whilst we're on the bike. We'll find that out more if we do it away from the bike. So if we want to find out if it's flexion that's creating the problem, what we can do, and this is one of the tests in the assessment in the online course, so you can go onto there and perform all the different ones and find out which one it is. But essentially, we come up into this position, so we're up straight to start with, and then we just pull ourselves down into the bench. So we're just compressing the spine. That should be fine. So what we then do in the next part, now it might not be, that's for the test and the assessment to conclude. So we then round the spine. So we now go into the flexion. And then again, we pull down, it's only about 20-30%, and we pull down into the bench. Now, if that triggers, it's not a lot of pain, but if you can just feel something at the lower back, so you're completely pain-free, and then you pull down and you just get a little hint of pain, then it's potentially flexion that is causing the problem. So then we need to start thinking about how do we put a strategy together off the bike, so when we go onto the bike and we're in that flex position, because it's very difficult to avoid it, how are we going to offset our lower back pain? So that is the key thing that we need to be thinking about when we've got lower back pain on the bike. If it's flexion, we're going to be in a flex posture. But if that's triggering the pain, we've got to be doing something off the bike to improve what we can do on the bike, because we can't really correct it. You could go through a certain bike fit, but if you're a road cyclist or a triathlete, then you're down in this position. You're not going to get out of the flex posture. It's very difficult for any cyclist to be out of a flex posture. So if flexion is triggering the pain, your strategy has got to be off the bike. Part number two, we're now talking about fatigue. So if we did the flexion test and we got no pain whatsoever, what we could be looking at now is fatigue on the bike. So if you look at the anatomy, you've got obviously either side of the spine. You've then got the psoas, which joins onto each lumbar vertebra, and T12, and parts of it go up into the diaphragm. It then goes through the pelvis and joins onto the inside of the leg. It's known as a hip flexor, which is the pulling up. Now, if this muscle becomes fatigued, you will potentially get a burning sensation in and around here. It could also be glute medius, glute minimus fatiguing as well. So if we can establish that we're not getting any pain in flexion, but we're still getting a burning pain around here, then we can start to think that it might be fatigue. These three things that I'm talking about is not like mathematics. It's not 2 + 2 = 4. We've got to take a little bit more due diligence than that. But what we can do is, if we can start to identify it, it helps begin the process to be able to move further down that rabbit hole. So fatigue. So if, again, we're pain-free in flexion, but we get fatigue come on over a period of time on the bike, one very simple strategy is to start thinking about, before it comes on, can I either change position? Can I get off the bike, take a break, have a little walk around, get back on the bike and continue? That would be one very simple strategy. The other one is to get these muscles working more effectively. So starting to think about stretches, exercises, foam rolling, to try and release the tension in these muscles so it doesn't build up and create that burning pain through here and here. Again, if you go through to the 12-week program, it's all there for you. The stretches, the exercises, there's a foam rolling workshop in there for you if you need it for glute medius, glute minimus, glute max, QL, it's all there ready for you. But fatigue is trigger number 2. So what we'll now do is look at biomechanics number 3. This can take two sort of sides. It could be the bike fit, or it could just be your personal mechanics. Now, with regards to the bike fit, I'm not sort of dealing with that because I haven't got a bike, I haven't got the tools to be able to sort of perform a bike fit. That would be something that you would need to do elsewhere. What we're going to talk about is the personal side of it. But when you are talking about a bike fit, it's basically the contact points. It's the reach length and the stem, so how far you've got to reach forward, but also it's the pedals and it's the saddle as well. They're basically the 3 contact points. The pedals, the saddle, and the handlebars, and the sort of the length and the height of those handlebars. So it's you being able to manage that. That would be on the bike fit side of it. On the personal side of it, when it comes to biomechanics, I've already touched on, you're not going to go into a straight spine. I watch certain cyclists who are sort of demonstrating bike fits, and they say, get your spine into a straight, or get your spine straight. The person then gets on the bike, it's clearly rounded, and they'll say, great, you've got a nice straight spine there. It's a very odd thing to watch, but maybe not to a not so well-trained eye. They just don't notice it, and they just take what they're saying verbatim. But essentially, if you're a cyclist, you're on a road bike, triathlon bike, mountain bikes are slightly different, but certainly road bike, triathlon bike, you won't be in a neutral spine, it won't be straight, it will be flexed. So that's a part of the biomechanics. But what we've then got is what the hips, the knees, and the feet are doing. So again, with the bike fit, some of that could get sorted out. But what a bike fit could do, it could show up other problems, because if you get properly bike fitted, it's going to put your body in a different position. If your body's in a different position, it could then start to react. So what we need to start thinking about are exercises to help get our foot, knee, and hip interacting well with each other. When we go into the pedal stroke, we need to think about not coming up so high. So it might be that it's getting crushed up here because of what the saddle's doing, which is then creating dysfunction through here, which we then need to sort out, glute medius, glute minimus, TFL, so on and so forth. So we need to start focusing on loosening off through here. What we've also got is when we push down, is the knee caving in as we push down? So have we got that sort of movement? Because we want it to track. Again, this is coming from this part of the hip. There could be influences from the pedal, there could be influences from the saddle, but if those have been corrected and it's still happening, then it's your muscle that needs correcting to be able to align that all the way down. So if you're getting lower back pain on the bike, step number 1 is figure out where is it coming from. Is it the flexion posture that you're in? Is it the fatigue of cycling and you're getting that burning sensation around here? Or is it your biomechanics and your knees dropping in, or you're flexing up too high or extending too low? Is it the biomechanics? And then when you talk about biomechanics, is it because of the bike or is it because of your body? If you've got that information, you can start piecing it together. If you click the link below, you go through to the how to overcome lower back pain program, and I'll help you talk through it. So we'll go through a consultation. It's all video format. So I talk you through the consultation, what the answers mean, or what your answers mean. Then we go through an assessment. Again, I talk you through what your answers to those tests mean. Then we start working you through the workshops in improving the movement, improving hip function, core function, knee function, so on and so forth, to help you overcome your lower back pain if you're a cyclist. So many thanks for watching. My name is Chris from Chris Pole Training. I'll speak to you in the next tutorial.